We're Group 7, and this is our case study project. I'm Laura Campbell.
I'm Annalise Pine.
And I'm Morgan Carrier.
And this is our case. In 2014, Dr. Farad Fata, a hematologist and oncologist from the Detroit area, was sentenced to 45 years in a low-security prison for the following counts: 13 counts of Medicare fraud, 1 count of conspiracy to pay or receive kickbacks, 2 counts of money laundering, and 553 patients who received medically unnecessary infusions and injections. One of his patients, Robert Sobreri, received chemotherapy for 2.5 years. Later, he found out he never had cancer to begin with. Due to high levels of medication administered to Robert in those 2.5 years, all but one of his teeth fell out, and his jaw began to change shape. The chemo treatments were painful and made him physically sick. Another patient, Chris Sneary, was a cancer patient. He received gross overtreatment with harsher chemo treatments than necessary. He even had a testicle removed that was not medically necessary. The ethical reasoning behind this case: he violated many ethical principles, including non-malfeasance, which states caregivers are required to avoid causing harm, which he did by inappropriately treating his patients, disregarded his patients' rights to complete autonomy, and broke the Hippocratic Oath, which he took as a physician to do no harm.
This case also had many legal issues, such as Medicare fraud, money laundering, receiving kickbacks, mistreating patients, resulting in some of their deaths. He nearly received $35 million from Medicare due to fraud. Seeing around 50 to 60 patients a day, he was handing patients over to unlicensed doctors who received their medical degrees from other countries that he employed. He pushed for longer, more intense treatments and badgered patients if they refused the course of treatment. The court found him guilty, and he pled guilty to 16 counts out of 23 that he was being prosecuted for. His medical license was revoked, and he will be serving 45 years in a low-security prison in Michigan. Our stance was that we believe Dr. Fata received a light punishment of 45 years for all the mental and physical damage he caused to his patients. We do agree with the verdict of revoking his medical license so that he'll never be able to practice medicine again. All private practices should be evaluated annually and be able to provide all proper paperwork necessary for their employees to be able to practice medicine in the United States.
And we came up with a quiz just to see if you were paying attention during our project. Question 1, what was Dr. Fata accused of? Question 2, how many counts did Dr. Fata plead guilty to? Question 3, what were the 3 ethical principles that he violated in this case? Question 4, how many years was Dr. Fata sentenced to in a low-security prison? And question 5, where did Dr. Fata practice medicine? Answers to question 1, he was guilty of Medicare fraud, conspiracy to pay or receive kickbacks, money laundering, unnecessary injections and infusions. Answer 2, he pled guilty to 16 counts. Answer 3, non-malfeasance, autonomy, and the Hippocratic Oath. Answer 4, he served 45 years in prison. And answer 5, he was practicing medicine in Detroit. Thank you.